Yeah, currently, this is, of course, right off the press. Now we have approval for a vaccine from Pfizer, the Pfizer vaccine for kids ages 5 through 12. So that's exciting news for you're looking at a population of folks who are at high risk and now have an opportunity of vaccine protection. Well, when you look at the impact that COVID has had on kids, not as much in terms of the infection itself, but we know that they have always been at risk, even early in the pandemic. But the impact that they've had on their schools, their socialization, all of those things that have been impacted by COVID because they have not had the protection afforded by having a vaccine. Well, the vaccine, there's a lot of unknowns here, of course. First of all, initially in the pandemic, we thought the people who were vulnerable, who are traditionally been vulnerable, are the elderly and children. And then as we went through the pandemic, it didn't seem to be the case. It ended up being the people who were high risk, who were poor health and elderly. But as we evolved in the pandemic and understanding that there are a lot of variants that are out there, we did start seeing the increased risk of death and hospitalization in people who are younger. So if you want to protect yourself, the vaccine is the way to do it. So the kids who are unvaccinated, now that population of folks are at risk. Now, we don't know when that will happen, when another variant will come along, but we know that COVID-19, the coronavirus, is here to stay, and we got to do everything that we can to protect the entire population so that we can move it from being just a pandemic to something that is really just an endemic virus. Great question, great concern. As a parent myself, I weigh that as well. When you look at the studies, particularly with the Pfizer vaccine, the dose that's much lower than we had in adults, right? There was no incidence of any adverse effects. So I think that really parents initially, there were some younger folks that got a vaccine that had some heart problems, some myocarditis to be specifically, that we didn't know if there was really a causal relationship to it. But what we do know with this vaccine and this approval is that it's safe in children, especially when they looked at it in that age group that it's approved for. So we always have to, as a parent, weigh risk versus benefits. Remember, the COVID vaccine isn't to prevent you from getting COVID. It's really to prevent you from being hospitalized or dying from it. Pretty much the same kind of point we do with the flu vaccine. So I think that parents, obviously, there's a concern there about adverse reaction, but you really want to ask yourself this: what's the most important thing that you need to do now? And that is to protect your kids now based on what is known, not the unknown of a possible risk that we do know at this time is really small. So you have to weigh that benefit of getting it done versus the risk. I do the same as a parent. There has been, of course, and that's why the FDA, the advisory committee, that's why a whole bunch of scientists have looked at this and asked the question first: is it safe? We know it's the right thing to do, but the question of is it safe, there's been a lot of studies that have been borne out with that. But just like any scientific study, you do the study, you don't know until you actually really implement widely to see if there's any adverse effects that are obviously going to be surveyed and really looked at over time, just like we did with the adult vaccines, which are in practice now, and we know that have far outweighed the benefits, have far outweighed the risk of any adverse events from the vaccines. Well, right now it's not mandated the way that we've had with those other traditional vaccines, right? Because those vaccines traditionally have had a long history of knowing the benefits, which we clearly have known those, the exposure, the risk, and whatever. COVID-19 and with the vaccine, getting that for children, especially in this group, is brand new. And so we don't have the long-term clinical experience about that. But really, when you look at it, it's the right thing to do to protect your child. And we have to understand the COVID vaccine is going to be around for a long time, our need for it. And it really is one of those tools that is going to be used in addition to social distancing, wearing masks, all of the other proper things that we've done. It's the only thing that's going to really help us with mitigating the spread and making sure that we're able to go back to everything being normal. Well, it depends, really. There's been vaccines that take a long time and longer clinical trials because there wasn't really a great sense of urgency, right? But when you look at what has happened now with the urgency of COVID-19, it really just showed us that, yes, we have the ability, the resources, the resolve to make vaccines, produce them, distribute them widely in a very quick fashion. Before, it was really caught up in a lot of bureaucracy, a lot of just clinical trials that where there was a lot of unsurety. And the other thing is, vaccine development has progressed over many years, 20, 30 years, that the technology is far more advanced. So we're able to really produce a very effective vaccine in a short period of time. And the other thing was, the pandemic was across the world. So you had everybody working on a solution. And all of that technology that was known, all the research that was known, it was a collective effort in being able to come up with a vaccine in a shorter period of time. So as a parent, as an adult, as a scientist, as a physician, it doesn't worry me that it was done too fast. It just showed me that we have the ability to do it fast enough when we really need it, because all the people, the millions of people that died, we had to do something. Otherwise, this would continue to go on and nothing would be normal at this point. Yeah, that's a reasonable thought. It's a reasonable thought just to wait and see how everybody else does before you jump on line and doing it. That is probably something a lot of folks are going to do. But what they need to understand up front is there enough information for them, good, strong, solid information, advice for them to do it now. I guess I look at it this way. I don't want to risk waiting too long, and especially in the midst of coming up with a flu season, that I place my child at risk for getting something while I sat back and waited. There's no good reason or necessary reason to wait, especially when we're talking about supply and demand. Right now, they projected there's going to be plenty of vaccines to vaccinate nearly all the kids in a 5 to 12 year range right now in the United States. So there's not going to be any reason to say it's going to be so much delays in getting it. So as a parent myself, I say, hey, you know what? I want to do the best thing I can, make the best decision I can based on what I know, the trust that I have in myself, and what I want to do for my kids. And I'm going to do it as soon as I think it's available to do it. But everyone has to decide what's going to work best for them. But parents understand, and this is what my point for even being here is, that being confident that the vaccine is effective and is safe for your child. And if you want to protect your child from COVID and not having them be hospitalized or having them die, you got to get the vaccine. That's probably the smart thing to do. And if you want to wait a little while, I don't know how long waiting is, but I would say that, you don't want to wait too long before something happens when your child is the one who gets COVID and is hospitalized. Well, the emergency use authorization is an order that's a way for us to fast track the use of medications, therapy, technology, things that are going to be beneficial, things that you really look at the data and says we need to do something now, as opposed to waiting, which we've done traditionally for many years. The process that the FDA approved medications, the process of which they approve immunizations is traditionally a slow process. If that was the only way that we would be able to get vaccines and medications through, we would not be as far ahead in this pandemic in terms of our treatment options and our vaccine options. So the emergency use authorization was a way that we were able to bypass a lot of bureaucracy, in my opinion. No, it's a process of saying, hey, look, we needed to do something right away. And, it's like the health benefits, the benefits to everybody else, they called it that, right? It's because they needed to say, okay, we need to weigh the science, the data versus the spread of the disease, how we had to do something. So that's how it came up with that. But again, I said to your other point was that, yeah, we had the ability to make the vaccine effective and safe. We had a technology there. It just shows you the reason why it was so fast, because there was a sense of urgency. So the emergency authorization really was just to speak toward a sense of urgency of doing something, getting things that were out there that were going to be in the vaccines in the arms of people, just so they can protect them. I would just say, you know what's interesting about that question? Kids are the most vaccinated population of people ever. We all went through all of these vaccines. They have the experience of that every year, all of their shots that they have to do, right? And every vaccine in general, I kind of always think of it that you should feel something, right? Not only just a pinprick of the pain in the arm, but as you are injecting those vaccine, the particles in there that are meant to protect you, they're boosting your immune system. They're mobilizing all of your body's fighting cells. So there's, in that course of doing that, the body, the temperature goes up a little bit, you feel a little bit fatigued, you feel like something else is going on in your body. Well, there is. It's your body building up the immune system so it can fight the vaccine. So, of course, I think those things are common that parents know, which they do. So if you take your kid for an MMR, you take your kid for a flu shot, there's always something that seems to be, and kids react differently from year to year to those things. But I'm telling you, kids are resilient. It's usually adults who really make a lot more about a side effect than children do. In a sense, I say from the vaccine standpoint, they're much tougher than adults in that regard. But parents have to be wise and watch for major symptoms. Big changes will be things that you look out for, a bigger reactions. And I think that those things are apparent. And that's why you always just stay in touch with your primary care doctor, the pediatrician. Report these things. Let everybody know when there's something that has been dramatic, something you see this great difference. But remember, you're always weighing that benefits of that protection versus that small risk or inconvenience of having that vaccine. I think if you gave a kid a shot, and they right away that happens, and they monitor you kids right away. So if they had an anaphylactic reaction, right, mouth swelling, sweating, feel lightheaded, pass out, blood pressure goes up or down, that's in the course of that happens right immediately. That's in the course of seeing that right in front of the health professionals that are there, right? So that's the immediate kind of side effect. The thing that we look at longer, which we are known, it could be anything that should, a high fever that doesn't go down, right? The kid is just a lot more pain, swelling at a site where they gave the injection, things that I would say is dramatic. Really look at the history of what your kid has done. Your kid has had vaccines before, kind of model it and say, they've had shots before. Well, this is much dramatic or much more concerning reaction than they had in the past, and use that as your guide. I'm never in favor of mandates. I think that we need to give people the right information, right? Allow them to weigh that information, be educated, and make an informed decision for themselves. I'd rather me make the right decision based on what I trust before someone else telling me what to do. And I'm saying that as a parent and also as a professional. So my advice that I'm giving to my patients is based on them having the trust in me and me trusting myself in the clinical medicine that I'm delivering. And I say to them, trust yourself. It's up to you to do the right thing, right? It's very difficult. We've been through this pandemic and we are so frustrated with people telling us what to do. Well, a lot of times people will start telling you what to do when you're really not doing the right thing. So, do the right thing that falls right within your heart and what you need to do for your child. And that's what we need to do. Mandates are really set up to do things for people who are not doing the right thing. And that's what happens, right? So if everyone would understand, hey, we want to go back to normal, get out of this pandemic, we've got to all wear masks, we've got to all wash our hands, social distance, we've all got to get a vaccine, we're all on board. But guess what? You wouldn't have to mandate anything because it's what people were doing the right things for themselves. But when you have people who say, I'm not doing this, I don't believe this, then guess what? And they're trying to protect everybody else, right? Then you have mandates or something that evolve. Even though I'm not a fan of them, but I understand that parents have that, but I'm going to do the right thing first for me. And I didn't have to have anybody mandate anything to me because I've already done the right thing. I just say very simple as I've taught patients, just do the right thing for your family, for your kids, protect them. You don't want to have anything harmful come about to them. And so trust yourself, look at the data, look at what is the science about doing this and the why, and come to that conclusion. It's the right thing for you to do to protect you and your family.